How can doctors tell if there's something wrong with your internal organs? Let's go. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and as such, I am very much concerned with evaluating internal organs, but it can be a bit tricky because they're internal. You can't see them, so we have to rely on other ways to evaluate them. So the first way is the medical interview. If I'm seeing a patient who's coming in with a specific complaint, let's say chest pain or shortness of breath or maybe nausea and vomiting, I'll ask all the details about that complaint, and those can cue me in to figuring out if there's something wrong with one of the internal organs. For example, if you come in with chest pain, guess what? What's an organ that's located in the chest? The heart. So you might worry about problems with the heart, the worst case scenario being a heart attack. But there's other organs in the chest. The esophagus is another one. So acid reflux can also kind of feel like a heart attack. It can cause chest pain that feels quite similar. So you want to ask about all the details about the specific complaints that a patient might have. Now, the next thing we do is we do what's called the review of systems. So this is a series of questions. Well, it's just one question, really. It's, have you had any fevers, chills, night sweats, fatigue, changes in weight, headache, dizziness, fainting, seizures, numbness or weakness, sore throat, cough, runny nose, chest pain, shortness of breath, palpitations, abdominal pain, nausea, vomiting, constipation, diarrhea, pain with urination, increased frequency of urination, blood in the urine, blood in the stool, joint pain, swelling, or rash? Yeah, one question, but it's a big run-on question. Now, the point of that is to make sure that we haven't missed anything in the medical interview, because sometimes people may be experiencing other symptoms, but it's not the main symptom, so they don't really feel a need to bring that up when they see their doctor. So then when we go through the review of systems, we might figure out things that otherwise would have been missed, like, oh, I had chest pain, but you know what, now that you mention it, I also had joint pain. And I have actually run a low-grade fever. And then you put everything together, and then maybe this is like, I don't know, I'm making this up on the spot, but a bloodstream infection that led to endocarditis and also infected the joints. That would be crazy. But that's an example of how the review of systems can help you find other details that might cue into problems with the internal organs. So the next thing we do after the interview and review of systems is we do the physical examination. The first part of that is checking for vital signs. So vital signs include temperature, heart rate, blood pressure, and respiration rate. Those are the four main vital signs. I did a whole video on this. You can check it out there if you want more information. But here, if there's any issues with the vital signs, if they're abnormal, they can also give you some evidence that there might be something going on with the organs. For example, respiration rate. If it's very fast, you might worry that maybe the patient is having a hard time breathing. Maybe there's something going on with the lungs, like fluid building up in the lungs or some other abnormality with the lungs. So another way to get information about the internal organs. Next is the physical exam. So here we do our best. We can't see the internal organs, but you can pick up signs to evaluate them. So classic physical exam move is the stethoscope. This is probably one of the first things we learn in medical school is how to use this thing. So we can use this to listen to the heart. Now, what are we listening for? Well, heart rhythm, for one, abnormal heart rhythms, we call these arrhythmias. These can be an issue. You can pick that up with your stethoscope. But also we're listening for murmurs or abnormal heart sounds. This is a whooshing sound caused by blood flowing through usually narrowed portions of the heart, in particular the heart valves. If the valves are leaking, you can pick up murmurs. And also if they're too narrow, this is stenosis. Big one is aortic stenosis. That's when the very important heart valve that leads from the heart to the aorta, the largest artery in the body. If that becomes narrowed, you can get aortic stenosis, which you can pick up with a murmur. Now, in bad cases, this can actually make people pass out because blood flow is not optimal. And it can even be fatal. Sometimes people need to have their heart valves replaced. But that's a whole different topic for another video. Now, moving on, the stethoscope can also be used to listen to the lungs. For this, it's best to listen over the back. Can't really hear the lungs as well from the front. So we're listening for wheezing, crackles, any other clues that might give us some direction as to what might be going on with the lungs. If it's wheezing, we might be worried about asthma or some other reactive airway disease. If there's crackles, that might be an indication that there's fluid building up in the lungs. So again, very important tool to do the physical examination. Now, we also use this to listen to the intestines. So we'll listen to bowel sounds. This can show us that the bowels are moving, they're functioning properly. And not only that, but we'll also just use our hands, palpation. This is particularly important for the abdominal exam. If you're feeling the abdomen and it's very distended, very tense, and you can even percuss the abdomen. When I first learned about this one in med school, I thought it was a joke. Like we actually tap on people's bodies. But yeah, that's true. You would tap on the abdomen. Very distended abdomen. If it sounds like a drum, maybe there's air building up in the intestines or an ileus where the intestines aren't moving properly. So this is yet another way to gain more information now specifically about the abdominal organs. But there are some organs that are really deep in the body, way too deep to even feel. And so an example of this would be the kidneys. And yeah, it's pretty hard to palpate the kidneys really. Now, so how do we evaluate them? So in extreme cases, if the kidneys are very diseased, you might find signs of this. This can lead to swelling in the body. It can lead to changes in urination, like not urinating as frequently. But just less advanced kidney disease is harder to detect. And so in this case, we got to move on to the next thing on the agenda for evaluating organs, and that is our tests. So these come in two basic flavors. There's laboratory tests and then radiographic tests. There's many more, but these are the two main ones. So starting with the laboratory tests, basic labs would be a complete blood count, looking at the blood cells in the blood, and also the metabolic panel, which includes electrolytes and also kidney function tests, BUN and creatinine. So creatinine, for example, is something that the kidneys should clear from the body. Therefore, it really should not be a very large number, ideally less than 1. But in cases where the kidneys are not working properly, they're not able to clear the creatinine, and so you end up building up higher levels into 2, 3, 4. I've even seen it go above 10. So this can be an indication for kidney failure. Something that you wouldn't be able to see or even detect on physical exam, but you can definitely see it with your blood tests. Urine tests are also pretty key for evaluating the kidneys as well. Here you're looking for protein in the urine, sugar in the urine, other signs that there is something wrong with the kidneys. Same thing kind of goes for the liver. Although you can feel the liver if it's enlarged, you can feel that in the abdomen. You can also percuss the liver, but this is not very sensitive to try to get an idea of if the liver is enlarged or not. But the liver also has blood tests we can order, AST, ALT. You can also get an INR level, protein level as well, to look for the synthetic function of the liver. So using blood tests to evaluate the organs. Yeah, pretty much now that I think of it, most of the organs do have blood tests that we can order, like the pancreas. If you're worried about pancreatitis, inflammation of the pancreas, you can check a lipase. The heart, worried about a heart attack, you check the fifth vital sign here, I forgot to mention, is a troponin. Okay, just kidding. It's kind of an inside joke, but troponin is a blood test that you order when you're worried about a heart attack. Very commonly ordered in the emergency room setting. So sometimes it kind of feels like another vital sign, something that you would just get automatically. And for good reason. When people go in the heart attack or into the ER with chest pain, yeah, you kind of have to rule out a heart attack. So definitely something that's ordered quite often. So now we're done with the labs. Let's move on to radiographic studies. So these include X-rays, MRI scans, CT scans, and I guess those are the main ones. But the most common one that I see in the hospital setting is a chest X-ray. Pretty much anyone who's going to an emergency department, if we're really worried about breathing or some sort of problem with the lungs or the heart, a chest X-ray is very often ordered. Here's an example of one right here. And so this is a way that you can visualize any sort of abnormalities or changes in the lungs. But these tests, the thing to keep in mind now is that, especially as we get older and maybe with some comorbidities, a lot of these tests are not going to be normal. So you might look at a chest X-ray that looks abnormal, but maybe for that particular individual, that's more or less their baseline, and so for them, it's not particularly abnormal and not something that we would need to intervene on. So any of these tests, and I think especially the radiographic tests, you want to keep in mind the whole clinical picture. So you're treating a disease, you're treating a patient. You're not just treating a test. Okay, so that's something to keep in mind. And so that's X-rays, and then you've got CT scans, a little more detailed image. This chops the body in cross section, and so this, the CT scan, the more common one for this one would be to CT the abdomen, because an X-ray of the abdomen really doesn't give you a whole lot of information. I mean, you can see if the colon is very dilated, but it doesn't really show you a huge amount, certainly not compared to a CT scan, which is a much better way to visualize the internal organs in the abdomen. So not only the colon, but also the pancreas and even the intestines and colon. Wait, I already said colon, didn't I? So liver. Liver is another thing you can look at with the CT scan. All right, so we talked about the medical interview, review of systems, vital signs, physical examination, laboratory tests, radiographic tests, and now there's other tests you get too. So EKGs, I guess that's not technically a radiographic test, but it's a way to look at the heart rhythm, electrical conduction in the heart. You can also pick up signs of a heart attack with an EKG. There's other tests you can get to, things like lung function tests, where people actually breathe into a machine. We can measure the lung volumes that way. There's exercise stress tests, where you can run on a treadmill with cardiac monitoring to detect any signs of perhaps coronary artery disease. So the list goes on and on and on. And then there's all the invasive tests, right? Like a lumbar puncture. So here, I mean, getting blood, I guess that's invasive, but it's so commonly done. We don't really think of it as a big procedure per se. But lumbar puncture, where you take a big needle, put it into the spine and draw fluid from around the spine, that's a little more involved. But if we're worried about meningitis or viral encephalitis or something like that, we might get a lumbar puncture to evaluate cerebral spinal fluid. Then there's even more tests, the more invasive ones like a colonoscopy. I mean, that's quite common. It's actually recommended for everybody to eventually undergo colonoscopy for colon cancer screening. But this is where a doctor will take a camera, look in the colon, and can take samples, biopsies, try to detect cancer, but also look for signs of bleeding in the colon as well. So lots of tests, lots of ways to evaluate the internal organs. So in summary, even though you can't see your internal organs because they're, internal, that doesn't mean that we can't evaluate them and quickly and accurately diagnose problems with the internal organs. Thanks for checking out this video. If you like medical related content like this, feel free to hit the subscribe button there or check out another video here, and I'll catch you guys next time.